Good morning. I'm Pat Croce, and this is the American Cancer Society's HEALED community gathering. HEALED, if you're just with us for the first time in the past 9 months, HEALED is a word we're using that means health and energy through active living every day. And the HEALED research is going on as we speak in Atlanta, Georgia, at the headquarters for the American Cancer Society. And all the money raised by you and from you is going toward this research. And we've raised $2 million, a little over $2 million. And if you'd like to give and you want to wear our bracelet, our HEALED bracelet with the one green bead, just go to acshealed.com. And our intention for this HEALED gathering every Wednesday at 11 o'clock Eastern Standard Time is to educate you, inform you, entertain you, and encourage you to live more in the present moment and not suffer, not allow yourself, your mind, to project to the future or pull from the past and be at unease, but to be at ease during your cancer treatment or caring for someone who has cancer. That's our intention. And what we do then is bring on specialists and survivors, warriors, warrior goddesses every week for an unbelievable, fun, educational hour. Guaranteed something will touch you, tickle your funny bone, but really pull on the heartstring. And before we get started, I'd like to wish you all a happy new year. And even more importantly, a happy new now. So how am I going to bring you into the now right now? By ringing this bell. And this is almost like a meditative sound. And all I want you to do is rest your attention away from everything else in the universe and place it gently and lovingly on the sound of this bell. See? No suffering. When you're in the present moment, when you're in the now, the mind can't abuse you. You can use the mind and help yourself direct all of your attention towards something you need to do, but the mind can't abuse you. And for the next hour, we're going to take your mind on a journey with two wonderful guests. Our first is our specialist, Dr. Plimack, Elizabeth Plimack. Dr. Elizabeth Plimack is the professor of medical oncology, chief of the division of genitourinary medical oncology, and director of genitourinary clinical research. She said I could just say GU, and you'll know what it means, at Fox Chase Cancer Center. In short, Dr. Plimack is a specialist with bladder and kidney cancers. And we have Doctor with us right now. Come on, Doctor.
Hi, thank you so much for having me.
Oh, you kidding me? Thank you for coming. I know you have such a busy schedule. Thank you. And sorry, I kind of stumbled over some of those words.
You did great. You did great.
Genitourinary?
Yeah, genitourinary, or we call it GU, so we don't usually use the long version.
And what does that exactly mean?
So it's in cancer these days, we really have all become specialized for the most part with a focus in a certain set of diseases. And part of that is because there's so much more to know about each one because science is advanced. So here at Fox Chase, where I practice at our cancer center, our group focuses on GU cancers, and that includes kidney cancer, bladder cancer, prostate cancer, and testicular cancer. So we're sort of a system within the body. If cancer develops anywhere within that system, we're your specialist.
Okay, specialist. Take me back, though, Dr. Plimack. How did you decide to be a doctor and specifically an oncologist?
Oh, I love that question. So I had a roundabout path. I'm not one of those people who knew my whole life that I wanted to be a doctor. I wanted to be a lot of different things throughout my sort of teens and early 20s. I studied art, fine art photography in college, and then worked at an archive. I wanted to be a teacher, all kinds of different ideas. But ultimately, there was sort of a pivotal moment where I injured my toe, not severely, but I needed an emergency room and I needed stitches. I was living in New York City at the time, and I ended up at Bellevue Hospital, which is a safety net hospital for New York City near the Lower East Side. And while I was waiting for a long time, because my case was like the least urgent of the day, I was able to hear everything that was going on and hear the narratives of people who are coming for care, for healing, and hear the conversations of the providers in this very busy emergency room. And those narratives and that sort of window into the human side of medicine is what hooked me.
Wow.
So based on that really moment, I enrolled in the coursework I needed to complete to attend medical school. I did that at Columbia. They had a night program. So I did that, completed that, and ended up, believe it or not, training for med school and residency at NYU Bellevue. So
Wow.
the place where I ended was where I ultimately received some of the most amazing training, sort of across all different diseases in internal medicine. It's really an honor to train there.
Okay, take us on to the next step then. Since we have so many internal organs, oncology is quite a specialty unto itself.
It is, and it's interesting because when we interview fellows, those are doctors who've done internal medicine who want to be oncologists, I always ask them why oncology, because it is a really special calling. It's a very challenging place to be. It's a challenging career, but it's incredibly rewarding, sort of on many counts. And these are the things that drew me. So I did research. One of my jobs before medical school was doing research, and I ended up doing it for a group of medical oncologists. And so understanding, how new drugs were developed, how new treatments were framed, how badly we needed those new treatments because the treatments we had were just not good enough. All of that was real motivation for me to engage in a career of cancer care of patients and cancer research to develop new treatments.
Okay, before we go on, because I want to hear about the newness of treatments, does your art background add to your creative juices in research?
That's a really good question. I'm going to say yes. I think we have to think creatively about the very major problem of cancer. It is incredibly intricate. It is incredibly complex. It's really daunting. I mean, I think if we sort of wonder why we haven't cured cancer yet, it's just there's so many facets to cancer cells, cancer development, the human body, drugs, drug development, that make it all very complex. But if we weren't creative thinkers, and I'm certainly, one of many in the field who have thought creatively about these problems to come up with solutions, we wouldn't be able to get there. So I don't think an art background is required, but creative sort of flexible thinking certainly is. And we've been fortunate to have a lot of that in our field and have seen some of the results of that.
And you speak of your field within oncology, within internal medicine, within medicine. You are really narrowing down all the way. Why bladder and kidney cancer?
Right. That's a great question. GU cancer, so, some of my colleagues specialize in lung cancer or breast cancer or the gastrointestinal system of cancers. For me, genitourinary cancer offered the opportunity to treat men and women of all ages with very different approaches. So our approach to prostate cancer, for instance, leans a lot on the hormone axis and hormone therapy. Our approach to bladder cancer and kidney cancer is now more similar than it's ever been, but a lot of the treatments that work for one really don't work for the other. So that sort of variety within a limited scope is definitely a draw. And then I think once one commits to specializing, you really get engaged with the community of patient advocates, advocacy associations, of other researchers, and for bladder especially, and also kidney, we have a really strong community of international collaborators working on making lives better for our patients.
Doctor, I enjoyed you in the emergency room getting that aha moment, as Oprah would call it, and you decided medicine would be your career choice. Take me back though. Within oncology, what was the aha moment that you thought GU would be it?
So this one is less dramatic. I don't have as good a story for you for this. Really, I took care of a patient with testicular cancer as a resident, and I thought it was interesting. And when I went to fellowship, I did my fellowship at MD Anderson in Houston, Texas, where they're very subspecialized. Based on my request, they put me into a GU clinic. And there was just such a great group of mentors and doctors and patients in that environment. I was hooked. So could I have been hooked in a different specialty within oncology? I'm sure.
No,
it's
no,
it's
no,
like the
no,
people you
no,
meet,
no,
you know,
no.
who
Grace
pursue
worked
it.
within you. Grace worked within you, and
Yeah.
what you it was established in that truth and love, and it came out as a passion in the GU field of oncology. Now, you talked about art, you talked about research. In your research, I read some things about you and how you're helping to create these new discoveries for therapeutic approaches and predictive biomarkers. What
Mhm.
is that?
Sure. Thank you for that question. So, when we see a patient with cancer in front of us, one of the least satisfying parts of the first conversation we have is whatever treatment we're recommending, we don't know for sure that that's going to work for the particular patient.
Oh,
We can lean on statistics from how other people have done, but we don't yet in the cancers we treat, bladder and kidney, and that's changing. So we have a few clues in bladder. We don't yet know how to take the tumor, understand its biology, and know exactly what treatment will work. So that's what we strive for. I think in lung cancer, they're further ahead with that, right? They get all kinds of testing on the piece of tumor that comes from the patient, and they know how to match what treatment. We're still evolving that in kidney cancer, and we're a little closer in bladder cancer with some of the biomarkers. But always we want to know how to help the patient in front of us, right? And leaning on actual specifics about that patient and their tumor is usually more helpful than statistics from prior patient experience.
so Dr. Plimack, if there is a ways to go still with the biomarkers, is there a screening? Are there screenings available prior to the diagnosis of GU cancer?
Right. That is a really good question. So, for kidney cancer, for instance, I think we'll spend part of today talking about that. There isn't a screening method. It's
No,
not
but
that
there is
common.
not a screening.
There's no screening. To be totally honest, most kidney cancer is diagnosed because someone gets a CAT scan for a different reason. They are in a car accident or they have stomach pain, and the CAT scan incidentally or by accident picks up a tumor on the kidney. If we're lucky, it's early and the tumor can be removed. But really, there's just no screening, and in a healthy person who doesn't have a need for imaging, it can sneak up on them. So we are working on developing that, but we're not there yet.
And how about bladder?
For bladder cancer, we're fortunate that usually an early symptom of bladder cancer is blood in the urine, which people can see. So what I'll urge your viewers today, if you have blood in your urine, always get it checked out. It's never normal. It's never okay. And it's something that really requires evaluation. It's not always cancer. In fact, most of the time it won't be, but it's something that should be checked out. So with bladder cancer, we don't have an early detection method, but we definitely have a symptom that usually appears in the earlier stages.
So you're saying you are hollering out, if you have blood in your urine, have it checked out.
Yes, please. Yes.
Perfect. So now, how about healed health and energy through active living every day? And we're promoting an active lifestyle before cancer, with cancer, post-treatment to cancer. How about preventative medicine for the prevention of GU cancers? Does anything work?
Well, the biggest thing, and this won't be a surprise to any of your viewers, is to never smoke or quit smoking if you are a smoker.
Oh,
I think people think of smoking as causing lung cancer. That's well known. But it's actually the major link to both bladder and kidney cancer. The carcinogens from the cigarette smoke are filtered through the body, filtered through the kidneys and the bladder. And the biggest risk factor for both those cancers is smoking. It's something patients can modify.
how come I don't know that?
A lot of people don't know it. I'm happy for this opportunity to share that information with you and your viewers. I think people know smoking's bad for you.
Right.
We can add to the list of problems it causes, though.
But yeah, people do, as you say, talk about lung cancer, but they think, oh, I'm breathing okay. They have no idea that invisibly it can also affect your bladder and kidneys.
Right.
How about the ingestion of more hydration?
Yeah, that is important. And, if you're holding in urine and not going, for instance, truck drivers, long haul truck drivers who are dehydrated, who don't, urinate in a healthy pattern, there is some sense that there's an increased risk there. But good hydration is just always good. I think none of us, myself included, drink enough water during the day. It just, it's just really good for health in many different ways, especially in this dry weather we're having here in the Northeast. Really important.
I totally agree, doctor. And I get these cracks in my thumbnails and little things like, and my wife goes, "You're not drinking enough water." Okay. And I thought I am, but probably not. So take us now, once you diagnose, once you treat your patients, your GU patients, and they have either bladder or kidney cancer, how's the prognosis?
So that's a good question. It varies. My practice, I'm a medical oncologist. So most of the patients who come to me for care are in a situation where we can't say we can cure them, right?
Stop. So you're telling me that all the patients you see every day, one of the lines you have to say is that there's no definite cure?
For most patients I meet, that's true, Pat. Yeah.
Wow, you're a saint. Wow.
I know. And part of why, I'm in this field is I hope one day I can say something different. And in the meantime, we're really achieving sort of our secondary goal, which is helping people live active, full lives for many years with cancer, right? If I can't cure a patient's cancer, I want them to coexist with it peacefully and be able to live a full life. And I think, Pat, you're sort of ringing that bell and centering us all in the moment, is something that I really try to talk about with all of my patients, that, you're here, you have living to do. That's your job. My job is to keep the cancer on the back burner for you so that you can live in the present. Obviously, our success in that is not 100%, and we do have patients suffering with side effects, but we also work hard to manage or problems from their cancer, symptoms from their cancer, which is a big part of our job in medical oncology, supporting patients through the whole journey. But what excites me about the field today is that for patients I see now, I have much more to offer them than I did when I started practicing 13 years ago. I know in the future I'll have even more.
Give us some examples, because I love this line you said, you have living to do.
Yeah.
I want to know how you get that across, because that's something that everyone can benefit, let alone your oncology patients.
I agree, and I think that's something a lot of us who practice medical oncology, as hard as it seems to have these conversations regularly, we're very centered on mortality and living in the moment. I mean, I think it's one of the gifts that comes with seeing this on a regular basis. But how I talk with them about it, I'll tell you, my patients bring a lot of wisdom to the visit as well, and they often share with me strategies. But one of the ways is we prioritize vacations. COVID's made it so much harder, but we really try really hard to get people to maximize time doing what's important to them, helping them make decisions about whether to work or whether to retire, really just kind of, again, making their cancer treatment tolerable so that they're not thinking about it every day and they're not having symptoms from it. So those are our goals.
So more than a doctor, you're a psychologist, a mother, a guru, someone who, listen, I have an oncologist and I depend on what he says. Mine's nothing, but I still, every 3 months, I want to hear something and I'll ask a question. But it's so relieving to hear my doctor say something that I either can put to use or puts me at ease. So obviously that is your role in this planet.
Well, Pat, I'm really glad that you say that. I would love to say I do all those things. The truth is I work on an amazing team. And while our whole goal, shared goal, is to convey those things to all of our patients, the team approach allows me to lean on the expertise of my amazing social worker, Holly, my physician assistant, Colleen, my nurse, Allison, my colleagues, all of whom support our patients. So one person can't be all those things, but our goal encompasses all those things, and we achieve it together.
And I'll end on that, but that's beautifully said, and you're being very humble, because in that present moment, it's just you and the patient. So what comes from your presence with that patient is what has an impact. Yes, the whole team, if the whole team does it, then in sports, we consider that a win, right?
Right.
But it's truly a win just when you do it. So I just applaud you on your approach to patient treatment and the follow-up following cancer to, I love that you have living to do. So go do it. I love it. Why don't you just sit on the bench for a little while, Dr. Plimack? I'm going to bring you back. I'm not done with you
Okay.
yet. And we're going to
Okay.
bring,
My pleasure, Pat. Thank you.
thank you. Our next guest here at our ACS Healed Gathering on this beautiful first Wednesday of the new year is David April. You're going to dig this guy. David has a diagnosis of kidney cancer from 2015, and I'll let him take you on a journey of how it happened and where it has gone. But also, he's the founder of Fishtown Beer Runners. That's all I'm going to say. That's all I'm going to say because right there, I'm interested. David, come on, David April.
Hi, Pat. Thank you for having me.
Are you kidding me? Thank you for taking the time. I know I was talking about Dr. Plimack being a guru. You're like a running guru and an inspiration and courage personified. So, David, before we get into the running part of this show, take me back to when you realized the diagnosis of kidney cancer.
So, well, first off, I just want to thank Dr. Plimack for all she has done for me, she and her team. It's been wonderful to work with her and to see what she brings beyond just dispensing medicine. She also brings a sense of live your life and this sense of encouragement. So I do appreciate that, not only on myself but also on behalf of my family. But
so, David, no, stop there. This is too good because I didn't even know you were her patient.
Oh, yeah.
So you to now come on and experience what she was saying that she does. Give us a little more detail.
I like to say that I'm on loan to Dr. Plimack. Initially, Dr. Kelly he is my oncologist, and I was he was treating me for about a year, and then Dr. Plimack had a clinical trial that Dr. Kelly wanted me to go into at the Fox Chase Cancer Center, and that's how I met Plimack. So. And then when I heard that I was been invited as your guest, I turned to Dr. Plimack to come along with me because I wanted to know more about her and about her background, but also the chance to tell others what a wonderful approach she has to the doctor-patient relationship.
Well, David, thank you. Thank you for exposing Dr. Plimack to us. I didn't know that either. Wow. I leave that all to Diana. Diana, our director here of the Healed Gathering, she's been getting such great guests. And so, David, now I'm sorry I interrupted because you throw me for some loops. Take me back to the diagnosis.
So I was training for in 2015. I was training for my 13th marathon. I was planning to run the New York City Marathon. And in August, as Dr. Plimack says, usually it's something else that sends you to the emergency room. I had a kidney stone. I had a kidney stone maybe 20 years prior, so I knew the pain. And it was the discovery of the kidney stone that led to the discovery of the tumor. So I had an 8.5 by 5 centimeter tumor on my kidney. My surgeon said he estimated it took probably 2 to 3 years, maybe even 5 years for it to grow to that size. So all the previous marathons I ran with that tumor. So I ended up in the emergency room, and that's when the diagnosis came down. That not only did they discover the kidney stone that was causing my pain, but they also discovered the tumor.
So take us back to that moment.
So prior to going to the emergency room, I was at the Philadelphia airport, waiting the arrival of my children they had spent all summer in Spain. And my wife and I are waiting in the international, section with our welcome home signs. And while I'm holding up that sign, all of a sudden I get this, jab, this felt like a knife going through my side. And I'd experienced kidney stones before, so I knew what it was. So that's where that's my mindset, was trying to get through this welcome, because I wasn't going to let the kids know that I was in so much pain. And then we jumped in the car, and I just said to my wife, Carmen, just drive me directly to the emergency room. We'll make up a story, but just drive me there. So I was in the emergency room, enduring probably the worst pain I've ever had. And then several hours later, in the room with the doctor, and the doctor, I could tell, was feeling almost as much pain as I was, pain and having to communicate this news, and so it was it's everybody's worst nightmare to get that diagnosis. You see it on TV, you hear about it from friends and family. You just wonder if that is ever going to come down to you. So, as with everybody, I was in complete shock. And the world kind of, my body went numb. My poor wife, took it really, impacted her as well. And I was just in shock. So that was basically it. It's sitting in the Jefferson, hospital emergency room, trying to deal with what comes next. And I just have to say the doctors are so professional, and so, not only, they deal with this every day. They understand that we don't, and they tried to make it as, they tried to make the best of a worse situation for me. And the first thing they did was they explained to me the scenario, the sequence of events. And they told me, they said, tomorrow morning, you're going to get a phone call. And tomorrow morning came, and I got that phone call, and every time they said something, it happened. And that was reassuring, and that was helpful.
And what was the treatment plan?
So, the surgery, well, if I could back up just a moment,
Sure.
and when I'm sitting there in the emergency room, you asked what was going through my mind, and it took me back to my running, because of my running, I had met someone, somebody who I'd running with, and he had kidney cancer, and we were on a run, and he was explaining to me, and I was half listening because he was older than me, and kidney cancer, I'd never heard of kidney cancer before, and I never thought much about it. So, but he was explaining his ordeal, and that it was a second bout of kidney cancer for him. And because he told me that story while we were running, whatever it was, a year later, when I was diagnosed with kidney cancer, I had a phone call to make. I knew who to call.
Oh,
I knew who to call. So that next day, the first phone call I made was to Pat McCool. And Pat McCool said, listen, these are the questions you need to ask. And you know what, David? We're going to make it. You're going to make it through this. We're going to make it through this together. And we're going to have a beer together. In about 6 months, we're going to be laughing this off. And he gave me not only some questions to ask, but also some reassurance, some support, the knowledge that, hey, somebody else is ahead of me, has gone through this, is going through this, and has created a path that I'm now on. And that I'll always be indebted to Pat McCool for that. And that is why I'm public about my cancer, is because he was public about it. And the questions he told me to ask was to find out if my cancer tumor was encapsulated, and also to find out what type of surgery they're going to do. Because his initial surgery was 15 years ago, where they did a full body cut, and he was recovering for months from this surgery. But I found out upon meeting my surgeon, Dr. Lawless, was that essentially, to quote him, that I had cancer for dummies. So I heard that. I heard cancer for dummies. My wife heard cancer. Okay, so let me just take you through what I heard as cancer for dummies. He basically meant was that I could be cured through surgery. It was a large tumor, but you know what? It was encapsulated. They could remove the tumor.
What does that mean, David? What does encapsulated mean?
I think meaning that it hasn't spread.
Okay.
It was within certain markers. I think Dr. Plimack could explain it better, but from my understanding is that it was still fairly contained, but large, but contained. And so they were going to go in laparoscopically, not to do a full body cut, and I would be up and out before you know it.
David, can you give us some example of what the size of this tumor was? Is it a ball?
Like 8.5 centimeters, I guess, size of my fist.
Wow.
Roughly, pretty large. I think they staged it as a stage 3 tumor. So sure enough, I had the surgery. I was up and out. 3 weeks later, I ran a 5K.
No way.
And I just moved on. I moved on. I just moved on with my life. The following year, I went and I did run the New York City Marathon to celebrate.
Was that number 14?
That was 14. And then 2 weeks later, I did number 15 in Philly. So
Wait a second. You, after running 26.2 miles in New York, you come back and only 2 weeks recovery time, you run another marathon?
Well, I had two organizations I had to thank, and that is the American Cancer Society. So that's who I ran the New York Marathon for determination, their running program, which is an amazing program. And then 2 weeks later for the National Kidney Foundation. So I just felt like I wanted to raise money and to raise awareness and thank you.
How did you make out in both of them?
Say again?
How did you make out in both of them?
I finished. I mean, I'm not a speed demon by any chance, but I finished, fairly, respectably for that. And but I moved on. I moved on, and to the point where I didn't even consider myself a cancer patient. I considered, this was like getting my appendix removed kind of thing. And I never really thought about myself as a cancer patient. But back to my wife and my family who had more experience with cancer, it made me realize that there's no such thing as cancer for dummies because sure enough, 2 years later, my cancer returned. So even though the initial tumor was gone, in 2018, I ended up with metastasis in my lungs, a year later on my pancreas, and in my other kidney. So now I definitely am a cancer patient, dealing, as Dr. Plimack has said, with a variety of exciting new treatments. So that's a little bit about my diagnosis.
Now, did these metastasize as tumors?
Yeah, as lesions, yeah, or tumors. Mm-hmm. Yeah.
And then were there any more surgeries or chemo or radiation?
Yeah, and that's what's really interesting is that from what I understand, and Dr. Plimack can correct me, I don't think they treat kidney cancer and metastasis necessarily with chemo or radiation. In fact, I've never had radiation or chemo. But rather, I'm doing a course of oral targeted therapy, which is oral, as well as I did a course of immunotherapy, which is your immune system ramping up to fight the kidney or to fight the cancer, which is really amazing and mind blowing to think that I've been a kidney cancer patient since 2015, and I'm just taking pills. I mean, it's amazing to think of that, and that I'm continuing, my daily activities, working and running and all the other things that you do to have a full life. This cancer has not stopped me, and a great reason for that is all the research, all the new breakthroughs in treatment, and all the the wonderful professionals, doctors and research scientists, so on and so forth.
So you're running right now. You are totally like a textbook healed. After can you hear me?
Um,
Hello?
yes, go ahead, Pat.
Okay. After your last diagnosis, you are back to running.
Yeah, I never really stopped. So, running has been an important part of my life. It
Well,
is,
take us back, please, because tell us how it's been important, and then tell us also about the Fishtown Beer Runners. I want to hear all about this.
so my cancer journey and my running are very closely intertwined. Back in 2007, in my early 40s, I was going through a divorce, and it was rather difficult for me, and I needed a way to channel my my depression, my sadness, whatever it is. I needed a way to channel that. I learned a long time ago that one way to channel that, or a negative way to channel that, is through medicating, and I didn't want to do that. It wasn't really in my nature to drink or to do drugs or any of those things when you're sad and depressed. Because I just realized that, you know what, you're just going to end up farther down, and you have farther to go to get back up. So whatever it is, I don't know if it was a survival technique or something inside my inner voice, said at my lowest point, was to just walk out the door and run down the end of the block, and that's what I did. I never ran in my life.
David, nothing about running prior to this. This came out of nowhere.
I'd run occasionally on a treadmill. I played high school baseball and back in the early '80s, but no, I never ran. Out running, I would drive and I would see at the stop signs, I would see those runners, looking at their watches and their spandex. I thought that was ridiculous. I was not a runner by any means. I never contemplated being a runner. I never wanted to be a runner. And so what it was that compelled me to run, it was, I think, it's just an inner voice, something inside of me saying this was my path to survival. And I didn't realize the impact it would have until much later. But I ran. I ran down to the end of the block. I felt a little better. So when you feel a little better, what do? You run around the block twice. So I ran around the block twice, and I was so amazed at of how I was feeling that I asked a friend who was a runner, my friend Eric. I said, Eric, I just discovered this. I want to run a 5K. And I said, I don't know what 5K is. To me, it could have been a marathon for all I knew. And I said, train me. And so he started training me. And our training was more therapy, really, for me, because as I run, I tend to talk. And so all this stuff started coming out about what I was dealing with. And he was, just such a gentle soul. And he listened as I was running to me unloading on him. And it became my medicine. It was, medicine. It was healing. It was therapy. He finally was able to get a word in edgewise. And one day we were running, and he says, David, I read about this study. It was done in Spain, the University of Granada Medical School. Dr. Castillo, he did a hydration study with beer. He said if you drink a beer after a run, it won't hurt you, and you might end up a little happier. Talk about stopping in your tracks. I'm like, whoa, what? So as we're running, we're passing by a bar in North Philly, and we go into this bar and we sit. We just had run like maybe 5 miles, and we start talking about this study. Is it real? Is it made up? Is it a lager? Is it an ale? Is it, all that stuff. And in my mind, I had this very romantic vision of this doctor in a white lab coat with test tubes, testing beer and all that. but anyway, so of course, it led us to do this more often. So every time we went to a run, we would drink a beer, and then I realized this is bigger than us. We need to share this with the world, and I
Wait,
started.
wait. Too good. So there was this moment that you realized this was bigger than us. What was that? Take us there in that moment where this is bigger than us and you decide to do whatever you decide to do.
I think my nature is I like to share. I'm a community guy, and part of it is, I didn't necessarily like running. So I wanted to share the pain, but also to share the excitement that, listen, you can do this. I was in early 40s when I started running. You can do it too. And this is a hook that I have. We can make it about running, but we can also make it social. We can make it fun. Because when I started running, I looked around at other running clubs, and most of them at that point were training clubs. And I was too embarrassed or inhibited to join like I said, a real running club, if you will. So I decided, you know what, I'm going to start my own. And my vision, and it really has worked, is that I wanted the opportunity to have people that felt, that they couldn't join a club, to break down those barriers, and to have a new runner, a novice runner like myself, to after a run, to have a beer with, say, a marathoner or a more experienced runner. And to have that combination is really where the magic happens. And I found that to be true. The next thing you know, not only was I running marathons, but new people would come up to me and say, hey, I never ran a mile before. I joined the club. Next thing you know, I'm running outside of the club with these other people that are crazy runners, and we're having fun. And the club has pushed people to.
Okay, wait a second. You jumped way fast forward. 2007, you've never ran, and now you're talking about marathoners. I want to know, you had this inspiration. Grace struck you, one, to run, first of all. Secondly, then you have this inspiration to create it and share the joy. And then you form this. And why is it Fishtown Beer Runners?
Because I live in the Fishtown neighborhood of Philadelphia, and I decided, hey, let's name it the Fishtown Beer Runners. Was that what your question was?
Yeah, that was it. And then how did people come and get recruited? Like, were you on the street corner? Like, what happened?
It was amazing. It was just word of mouth. Well, first off, this Fishtown Beer Runners are credited really to. I mean, I'm not the first guy to run and drink a beer, or even the first running club to run and drink a beer, but we really popularized the movement, if you will, because not only do we have 20 chapters around the country, but we have like 80 chapters over in Spain now. But it was just word of mouth. Initially when we started, runners thought we weren't real runners. They thought we were, it was a lark. And bar owners and restaurant owners thought we were crazy. And now you can't run a 5K or a marathon without having an official beer at the end of it. That's crazy. But I think the magic is that, if I can do it, then you can do it. And I think that is what people are curious about it. And I think it just took off because people wanted to find out for themselves, is this real? Are we real runners? And the answer is, of course, we are. And then later, we had a film documentary that actually got an award at the Philadelphia Film Festival. And I think that helped also popularize our movement.
And how many runners run with you every week?
Well, COVID has thrown a wrench in it a little bit, but we can gather about 100 runners on any one day. We've gotten up to about 100 or so.
And I hear that once a month that you generate funds for various charities.
Yeah, I think the community is it's more than running and more than beer. It's really about community and giving back, and we do fundraisers to support various nonprofit organizations. I feel that's very important. My idea is that, hey, you have all these runners in one place at one time. They're buying a beer, which in Center City can get pricey, especially if you have 2 beers. Why not that 3rd beer? Why not donate that? Donate that money. And that's kind of the concept.
So before we bring Dr. Plimack back on, tell us your toast at the end of the runs.
So our motto is responsible running and drinking in the interest of science, and homage to the professor, to Dr. Castillo, the researcher in Spain. So our toast is, we are the Fishtown Beer Runners, responsible running and drinking in the interest of science. And then we yell out to the professor, and we toast the professor. And the professor who I've met, he actually invited me to the medical school in Spain to give a presentation about how we've applied their research. He has told me, he says that he feels that he is the healthiest person in the world, because every year since 2000, or every week since 2007, people in the United States toast to his health.
That is beautiful. And now, right now, in the present moment, you are running a regular program?
I am running. It's been difficult. I've had some side effects from the medication that I'm now on a new medication that I hardly feel any side effects. Thank you, Dr. Plimack. So I'm back, and
let's bring her on. Let's bring her on, David. Let's bring Dr. Plimack on. Thank you.
Hello.
Doctor, two of you, I didn't know he was the one that suggested you, so I applaud him.
Yeah, he got me into this.
So now we're talking about, you talked about earlier during your interview that just because it works with one patient doesn't necessarily mean it will work with another, and that you alter the medications. And David's saying that one medication didn't work, but this one is. What happened?
Right. I mean, I think, and David can speak to this, at every juncture in his care, we're always assessing how he's feeling, how he's doing overall, but specifically what the medication might be causing and what the cancer might be doing. And based on all of that, we flex our treatments. We fortunately have had clinical trials for David back to back. And the drug that he's on is a drug that we hope to be approved for everybody in the coming year because it works well for him and others. He's not the only one. And it does have pretty minimal side effects. So, this is what we do research for. We've been working with this drug since its earliest iterations when it was a smaller biotech, maybe 6 years ago.
And this
it's great to see it helping people.
Dr. Plimack, this is at Fox Chase where you're working with this drug?
So I'm at Fox Chase. We're one of the sites for the clinical trial that David is on. We've been a site for multiple prior trials with this particular drug. And of course, we do multiple other clinical trials with different agents with different approaches.
And he brought your name up earlier, and I asked a question relative to his metastasis. There's no surgery there's no chemo or radiation as part of the treatment plan.
Well, not for David and not for most of our kidney cancer patients. So we use surgery, radiation, chemotherapy, which is a very specific term for a set of drugs that many of which have been around for a long time. Targeted therapy, which is what he's on, which is sort of a different biological mechanism. We use immunotherapy. There's, T-cell therapy. So we're very specific when we refer to these categories because they really are so different.
Wow.
But the general approach for cancer that's spread is to give treatments that go throughout the body, that treat the cancer wherever it is. And the targeted therapy that David's on as part of this study is in that category.
And so David's...
we hope not to need radiation or surgery to target one spot because we're targeting everything.
And so he reports back to you, letting you know the side effects or consequences of any drug, and therefore you can turn the dial slightly this way or that way?
Exactly. And especially in David's case, he comes to us, David, you've been really open with how you're living, how the things that you're not able to do, the things that you are able to do, and really focusing on what you can do and making the most of that. And so because he's doing well, and because the conversations have been more open, I feel like, David, we've gotten a chance to really focus on the living part in our conversations, and hopefully, we continue that.
I'm not shy about asking Dr. Plimack or telling Dr. Plimack, what's ailing me at the moment, and to tweak things, and absolutely. And she's been very open to helping me through the side effects of these various meds.
And David, can you share with us the transformational power of running, exercise in general, but running for you?
Yeah, what's interesting is, I thought running was as I mentioned, my medicine to help me through difficult times, but I didn't realize it was preparing me for my cancer journey. And the transformational power of running is that it does allow me, and I think other runners will say this, to be in the moment. You have to be in the moment when you run, especially when you run through Philly, which I love to do. I love running sidewalks of Philly, and but because there's so much going on, I just love that. But it makes me focus to be in the moment. But also, it just makes you feel better. It just makes me physically feel better. And then beyond that, for me, is just the running community in general. I mean, without having become a runner, and I would not have met the people that are sustaining me through my cancer journey. I would not have met my wife and my family. I've met them specifically through running, and then all the other wonderful people from Pat McCool to Dr. Kelly to Greg Garber, all these other folks that are runners that also are in the in the medical profession, that have helped guide and support me.
So this guide and support you, in addition to caregivers, your whole running club has become almost like an extension of Dr. Plimack, and someone that you can talk to on an everyday basis. And doctor, you used David's example of running post-treatment, post-cancer diagnosis as an indicator that healed health and energy through active living every day can benefit cancer victims and survivors.
Yeah, for sure. I mean, I'm really struck by a couple of the aspects of David's running that he finds helpful. And a main one is connection to community, to his family, to his folks at the beer group, all of those things. So for him, running has also had that added benefit. And I think all of our patients, even if they're not physically healthy enough to run or be as active, can find that healing power through connection too.
That's beautiful. That's beautifully said. Now, I would love for David to get in touch with Dr. Erica Reese-Bonilla, who's heading up, the scientist heading up this research for HEALED, because you're a textbook. Oh my goodness, what you're doing. But I love, Dr. Plimack, how you're emphasizing the connection part, the medical, physical, soul part of exercise, which is something most people just glance over.
Mm-hmm.
David, give us our gathering, our HEALED gathering, and most are, I would say everyone's been touched by cancer, who's someone who has had cancer. Give us some insight, some input, some wisdom from your vantage point that we can take home.
Wow. I think that I think to remember that to make every moment count. And I've heard other patients and friends say this. My cancer has allowed me to no longer sweat the small stuff, and to put things in perspective. Getting a cancer diagnosis, it is basically alerting you that your time is limited, but all of our time is limited, and so now it's a gift in the sense that now I'm more focused to live every moment and to remember what's really important. Family, friends that are significant to you, and to weed out the noise and things that aren't significant. It's not always easy. It's not. Sometimes it's difficult, but that's the goal. And the goal is to realize that every moment counts, and look to the future, that you do have a future, and that's what sustains me.
Beautiful. And that's from a warrior perspective. Dr. Plimack, from a specialist perspective.
So I would just say, one thing we don't talk about probably often enough is how much our patients teach us and how much they bring to the table every time they come to visit. So David is an example of someone who had the courage to enroll in not one, but 2 clinical trials of treatments where when we told him about them, we said, we don't know all that much about this treatment, but we hope it'll work for you. And his commitment to sort of trying that for his own benefit, but also for the benefit of future patients is really admirable. And I think our patients' views and perspectives on life and living really help infuse us with the energy to kind of keep going and share that wisdom with other patients. So David, thank you for everything you've brought to us here at Fox Chase and for everything you're contributing to the kidney cancer community by being part of research.
Thank you. Thank you.
And I add thank yous to both of you, Dr. Elizabeth Plimack and David April. Thank you both for being so candid, vulnerable, courageous, and sharing your insights and wisdom and experience with our gathering. And I want to thank all of our leadership partners who have generously donated to our ACS Healed momentum, and especially 6ABC, who you can check out all of our Healed gatherings for the past 36 weeks on 6abc.com. And I like Dr. Plimack and David, I end every gathering with a simple, very simple prayer. Not a petitionary prayer, not asking for anything, more an attitude of gratitude. And just a thank you for the grace in helping me to welcome what is happening right now. And both of you have emphasized the present moment. You have a life to live, to enjoy life, make that hug count. Thank you for the grace to welcome what is. And 2 of you, thank you, thank you, thank you. Peace be you. Thank you.
Thank you, Pat. Thank you.